Good day, guys. I hope I find you all well. Welcome to our thoracic anatomy. All right, so today we're going to focus on intercostal spaces, um, and we are going to get into the clinic of intercostal spaces as well. Right. So here, this is your thoracic wall. Remember, it is conical in shape. The superior aperture, which is small, and an inferior aperture, which is wide. Superior aperture is closed by the suprapleural membrane. Inferior aperture is closed by the diaphragm. Laterally, you're going to have 12 ribs, rib number 1 to rib number 12. And then between each rib, the above rib and the rib below, there's going to be a space, and each space is going to be called an intercostal space, a space between ribs, right? So you're going to have 11 intercostal spaces with 12 ribs. Very important, right? So you're going to discover that there are layers that can be uh, pierced when you are inserting a needle in the thorax. They say that your patient had what you call pneumothorax. So pneumothorax is a condition where the air is in the pleural cavity. We'll talk about it. So you are supposed to pierce the intercostal space with a needle. So what are the layers that you have to pierce? So basically these are the layers before we get into the clinical part of it. First you're going to pierce the skin, right? You're going to pierce the what? The skin. And then after piercing the skin, you're going to pierce the superficial fascia. And then from the superficial fascia, depending on the position that you are, you may pierce the pec muscles, pectoralis major, pectoralis minor muscles, and you may also pierce the serratus anterior muscle, right? And then after that, after you pierce those muscles, you're going to pierce the three intercostal muscles. The most superficial being your external intercostal muscle, followed by an internal intercostal muscle, followed by an innermost intercostal muscle, and then you get to what you call an endothoracic fascia. And then from endothoracic fascia, you're going to have what you call extra pleural fatty layer, and then you're going to have your parietal layer. Right. So those are the structures that you'll be piercing when you are inserting a needle. Right. So let us get deep. So each intercostal space is going to be supplied by corresponding intercostal nerves, veins, arteries. And the vein, the artery, and the nerves, they will be within what you call the costal groove, which is medial to the inferior border of each rib. And we said that the costal groove is going to have the veins or the neurovascular structure in the costal groove is going to have what you call uh, a mnemonic code van. From superior to inferior, you're going to have a interthoracic vein, interthoracic artery, interthoracic nerve. Right. So what is important are the intercostal muscles, because these muscles, they are very important because they are responsible for respiration. Right. So there are two planes or diameters that you have to take note in the thorax. There's what you call a vertical diameter that goes like this. That's your vertical diameter. And then you have what you call an anterior posterior diameter that goes like this, right? So an anterior posterior diameter and a vertical diameter is very important for you to take note of those. Right. Let's get to the muscle. So the most superficial muscle that you're gonna face after you have reflected the pec minor and pec major, you're gonna see a muscle that is called an external intercostal muscle. An external intercostal muscle It's a muscle that is going to originate from the rib above and insert to the rib below. How do you know that this is an external intercostal muscle? An external intercostal muscle is going to have fibers that that goes forward, as you can see, and downward. So they go forward and downward, forward and downward, forward and downward. Or we can say they go antero inferiorly, antero inferiorly. So the fibers of the external intercostal muscles. So you can use the mnemonic or just an understanding of taking your hands into your pockets. So your hands will be your fibers, and if you put your hands into your pocket, the hands are going to reflect the fibers of the external intercostal muscle. The external intercostal muscle is going to be innervated by corresponding nerves. So if it is in the first intercostal space, it's gonna be innervated by the first intercostal, first thoracic first thoracic intercostal nerve, something like that, right? What is important is this: you need to know uh, the action of the external intercostal muscle. So external intercostal muscle, its action is to elevate the ribs by fixing the first rib. So the first rib, remember, it is fixed, it does not move, and you're going to have muscles that will be at the first rib. Remember, we have our scalene anterior, scalene medius. They'll be fixing the first rib so that it will not bulge into the neck during inspiration. So what is going to happen is this. Remember, we said that the external intercostal muscle fibers, they originate from the rib above, then insert to the rib below. So they are going to, remember, a muscle always contract towards its origin. So this muscle is going to contract in this direction. So it is going to raise the ribs. So as it raises the ribs, it's going to increase the anterior-posterior diameter. Anterior-posterior diameter, and also increase the vertical diameter. That's the external intercostal muscle. So it is a muscle of elevation. What happens when we elevate the thoracic wall? There will be inspiration. So external intercostal muscle is a muscle of inspiration. So you have to take note of this. The external intercostal muscle, anteriorly, it is going to extend as an aponeurosis. So here you can see it's going to end here, and then it's going to extend as this aponeurosis, this whitish aponeurosis. That is going to be called your external internal membrane, intercostal membrane, or your anterior intercostal membrane, right? Now let's go to the internal intercostal, So you can see your external intercostal, your internal intercostal, and your innermost intercostal. Your internal intercostal, it is behind the external intercostal. It also originates from the rib above and inserts the rib below. But the fibers now are different. So you're going to have fibers that are going backward and downward. You can see these are going backward and downward, backward and downward, backward and downward, backward and downward, or posterior inferiorly. Right. So it is also going to be innervated by corresponding nerves, right? And it is going to posteriorly around the angle of the rib. Remember the angle of the rib, we said what happens on the angle of the rib clinically? It is the weakest point of the rib. The angle of the rib is the weakest point of the rib. So at the angle of the rib, you're going to have this internal intercostal muscle extending as an aponeurosis. You can see inside here, you can see that whitish layer. That is your internal intercostal extending to the vertebra or to the head of the ribs as an aponeurosis. So this aponeurosis that is formed by the internal intercostal muscle is called posterior intercostal membrane or internal intercostal membrane. Formed by the external intercostal muscle is going to be called anterior intercostal membrane or external intercostal membrane. Symbol. What is the action of this muscle. So the action of the innermost of the internal intercostal muscle, it's opposite to that of the external. So it depresses the ribs while the uh, quadratus lumborum will be fixing the top of the rib, right? So the top rib is fixed so that the thorax, it will not get into the abdomen by the quadratus lumborum, whilst the first rib is fixed by the scalene muscles to prevent it from getting into the neck. Right. So what is important about internal intercostal muscle is that it is a muscle of depression. So it depresses the thorax. What happens when you depress the thorax? It means you lower the rib, and when you lower the rib, you're going to compress the lungs. When you compress the lungs, you are going to cause expiration. So internal intercostal muscle is a muscle of expression. External intercostal muscle is a muscle of depression. Let's go deep to the last muscular layer. So the last muscular layer is the innermost intercostal muscle. You have to take note that the innermost intercostal muscle, it is vertical, it is horizontal, uh, horizontal fibers, right? So it'll be having horizontal fibers, right? For the what? For the innermost, right? And it also have the same thing. But what is distinct about the innermost is that the innermost is divided into three, right? So it can be divided. We say it has three parts. Let me say. So laterally, you're going to have the innermost, right? Anteriorly, you're going to have what called the transversus thoracis, right? And then posteriorly, you're going to have the subcostalis. And because the subcostalis is a part of the intercostal muscle, you can see that the intercostal muscle, it spans from it can span from one rib to another rib and to another rib, or it can jump another rib and span to another rib. So it is not the same as the internal and the external that only attaches two adjacent ribs, right? And its action, it assists both external intercostal muscle and internal intercostal muscle in their action of respiration, right? So we said piercing a needle. If a needle is gonna pierce, it's gonna pierce the skin, it pierces the superficial fascia, it pierces the muscles depending on its position. If it is anterior, it pierces the pectoralis major muscles, but if it is lateral, it's gonna pierce the serratus anterior. And then it's gonna pierce the external intercostal muscle, the internal intercostal muscle, and the innermost intercostal muscle. And then if behind the innermost intercostal muscle, or let me say internal to the innermost intercostal muscle, you are going to have what called the endothoracic fascia. The endothoracic fascia, and then you're going to have the extra pleural fat layer, and then you're going to have the parietal pleura. Parietal pleura. So it is very important to take note of that. The vein that we were talking about, that we said it is within the costal groove of the rib, um, it is between the innermost intercostal muscle and the internal intercostal muscle. That's where you find the neurovascular. So this is your the innermost intercostal muscle, internal intercostal muscle, and you have your rib, you have your vein, your intercostal vein, intercostal artery, intercostal nerve between these two layers. And you're going to discover in abdomen the same arrangement of these muscles are going to be mirroring the muscles of the abdomen. So in place of the external intercostal muscle, you're going to have the external oblique. Is in place of the internal intercostal muscle, you're going to have the internal oblique. In place of the innermost intercostal muscle, you're going to have the transversus abdominis muscle. You see? And the neurovascular structures, they are also going to be between the innermost and the intermediate layer, right? So clinically, if someone, let's say someone has been involved in a car accident, and there's been force that has been exerted on the thorax, you can find the rib can break at the ankle, remember, and then the rib, it can pierce, or it can penetrate these structures and form a wall. So once a rib forms a wall, air is going to get in, and then a patient is going to have what you call tension pneumothorax. So tension pneumothorax, we are going to talk about it later, and when we are talking about the lungs and so forth. But you just have to take note that pneumothorax is air that will be entering the pleural cavity. When air enters the pleural cavity, it is going to cause the pleural cavity or the mediastinum, the organs in the mediastinum, to move to the other side. What we call mediastinal shift. We are going to talk about it. But what is important, if we want to withdraw that air, we do what we call thoracostomy. So thoracostomy is the insertion of a needle in the thorax, in the intercostal space, in order to harvest the air that have entered the pleural cavity. So there are two sides that the needle can be penetrated. So the needle can be penetrated along the mid-clavicular line, or it can be penetrated along the mid-axillary line or the mid-clavicular line. So I'm trying to see if right. So this is your clavicle. So if we are going to, we can draw a line on the mid of the clavicle going down. That should be called your mid-clavicular line. So anteriorly, we can go via the mid-clavicular line. So what are the structures that we pierce here? So you can see here at the mid-clavicular line, you can see that the first structure, yes, you're going to pierce the skin, you pierce the superficial fascia, and then you're going to meet the pec major, and then you reflex the pec major, and then you're going to pierce the clavipectoral fascia, and then you're going to pierce the pectoralis minor, right? And then after you reflect the pec minor, you're going to pierce the external intercostal muscle, you pierce the internal intercostal muscle, you pierce the innermost intercostal muscle, you pierce the endothoracic fascia, you pierce then the extrapleural fatty layer and the parietal layer, right? Those are the structures that you pierce in the mid-clavicular line. And then if you are going to do it in the mid-axillary line, you are not going to pierce the pectoral muscles. You are going to pierce the serratus anterior. Take note of this. The pectoral major, or the pectoralis major, it ends at the anterior axillary line. So here we are talking about the mid-axillary line. So the mid-axillary line is a line that is drawn within your armpit, right? That is between the anterior axillary line that is made by the lower border of the pec major and the posterior axillary line that is made by the lower border of the latissimus dorsi. And it is between those folds, anterior and posterior axillary fold. That's where you find the mid-axillary line. So in the mid-axillary line, you are going to, when you pierce the skin, the superficial fascia, you are going to meet the serratus anterior, and everything inside is going to be the same. And usually if it is going to be lateral thoracostomy, you're gonna do it mainly between the fourth and the fifth rib, right? Between the fourth and the fifth rib, that will be your fourth intercostal space. Most of the time, that's where it is done, right? So this is everything about your intercostal muscles. So there are muscles that you find posteriorly. Let me show you, like these muscles. You're going to have what you call serratus posterior muscles, and they are divided into two. You have serratus posterior muscle, or serratus posterior superior, serratus posterior inferior. These muscles, what I just want you to take note are their actions. The serratus posterior muscle is responsible for elevation of the ribs. So it also assists the elevation of the ribs during forced inspiration as assisting the external intercostal muscles, right? So it is a muscle of inspiration. So remember, it is just superior, so it elevates, right? And then the serratus posterior inferior muscle, it is inferior. So what do you think? It's gonna depress, right, these ribs. And then when you depress the rib, what happens? It is expiration that is going to happen. So it also assists with the internal intercostal muscle for expiration. So here, guys, that is everything that you have to know when it comes to the intercostal space. Thank you so much. Take care. See you next time.